Welcome to Orange County Power Players, where we spotlight the personal, professional, and financial success stories of OC's top leaders. Here's your host, Danny Flores.
Welcome back to OC Power Players, where I interview some of the most successful people in Orange County. I'm Danny Flores, your host, and today's honored guest is Dr. Paydar, zooming in from Newport Beach. Dr. Paydar is a Newport Beach board and certified plastic surgeon. He offers a full spectrum of aesthetic plastic surgery procedures at his state-of-the-art facility, Newport Aesthetic Surgery Center. He specializes including in breast augmentation, tummy tuck, facelift, mommy makeover, liposuction, breast lift, Brazilian butt lift, neck lift, eyelid surgery, and more procedures. In all cases, Dr. Paydar strives not to alter the body beyond recognition, but to make the human body better. Throughout his illustrious medical career, he has built an impressive reputation for successful and stunning natural results by innovating and striving for excellence in all aspects of body and facial plastic surgery. Dr. Paydar utilizes techniques that significantly decrease the chances of complications and speed up recovery times, like the no-touch technique for breast augmentation and his method for using multiple layers of plication for tighter hourglass results for abdominoplasty, along with keeping the incision at its lowest part of the abdomen, nicely hidden below the underwear line. These approaches ensure excellent outcomes, patient safety, and a comfortable experience for his Newport Beach plastic surgery patients. Welcome, Dr. Paydar.
Thank you for having me, Danny.
So tell us, how did this all come? What were you doing before? What was your plan, and how you got into plastic surgery?
So I was doing my training in general surgery at UC San Francisco back in the late 90s, early 2000s. And I was introduced to plastic surgery by one of my senior residents. And I saw how you can touch patients' lives from head to toe with plastic surgery. Other subspecialties, let's just say transplant or vascular surgery or just endoscopic surgery, all those things have their own specialty. They do, come with rewards, obviously. But the fact that I was able to operate from head to toe, that was really interesting to me. Reconstruction in patients who actually have trauma, cancer, where we can, put things back together using parts of their body as a donor site and then bring tissue over to close the major defects. Or cosmetics, which is what I'm into at this point. But yeah, we all were able to see how we can actually change people's lives and bodies, and I felt like that was my calling. Enter plastic surgery. It's a very hard fellowship to get into. But yeah, started my fellowship at UC San Francisco, and then I moved down to Southern California. That's where my parents are. That's where I grew up. And this was the area that I felt like we can actually help people. So that's how I got into plastic surgery. I did work at UC Irvine as a professor for 13 years, teaching residents, giving back a lot of patients with cancer and trauma. And so that was a great experience. But my calling was more about aesthetics. I do like art. I feel like, it takes a certain touch to bring the final results together. And not everybody has that, unfortunately. And so that's where I'm doing the majority of my work. A lot of face and neck lift, a lot of breast and body, tummy tucks, mommy makeovers, breast augmentation, reduction, lift, all those things, liposuction. And it just takes a certain eye to see the final product and achieve the final results, really.
Yeah, and it almost seems like something that you really have to do right the first time, because if you don't, now you have your results, bad results show, right?
Yeah.
Like good results show.
Of course. So, this is an industry where there's a lot of cash, obviously, and a lot of people get drawn to it for the good or for the bad. So there are a lot of people who are not board certified in plastic surgery. They don't have enough training. I spent 8 years training in general surgery and plastic surgery prior to starting my own practice, obviously. And I spent 13 years teaching residents at an academic institution. So it takes a lot of experience to understand the basics, the fundamentals. And some people bypass all that and go do a weekend course or do a 6-month course, and they call themselves a plastic surgeon, which is not appropriate. And they do
Right.
some of these surgeries and they botch the patients, and then they end up coming to me for revision surgery, which is a much harder operation, much longer operation, much more costlier. So do it the right the first time is the right thing, right? You save a lot more money that way, even though it might not be very cheap to do certain operations. Patients who go to Mexico or they go to Asia, they go to Middle East to have their surgery because it's much cheaper. It makes sense for a cost standpoint, but then once there's complications, who's going to take care of them, right?
Yeah.
They don't think about those things down the line. They just think about one price point that they have that satisfaction immediately to save some money, but then they don't think about the long-term consequences that they have to deal with eventually.
Right. It almost like kind of the reality of you pay for what you get, right? If you want
Exactly.
to go cheap, you
Yeah,
get
but it's your
cheap.
body, right? It's the body. It's not like a
Yeah.
car that's broken down. You can go fix it. No, this is your
Right.
body is forever. So it's investment you have to really truly think about.
It's a one-shot deal.
It
But
is.
but also let's talk a little bit about so somebody walks in your office and they want to get a tummy tuck or they want to get something a procedure done, right?
Yes.
I would imagine that when you once you're done, their glow, their confidence,
Oh, yes.
they're happy. They're like, oh yeah, this is what I had when I was maybe 18 years old. I mean, I don't know.
Or never. Some of them
Or
were like, I always had this issue, but now it's fixed. Or, they go through pregnancy and, they have, what we call distension of the abdomen, the laxity of the skin. And so that gets cut and gets tightened. And they're
Mhm.
like, I never looked this good before having kids, ever. And so, sometimes it brings tears to their eyes. And that's, the rewards that we get with this operation, with
Right,
kind of
right.
the
I can
industry.
imagine, right? It kind
Yeah.
of like a confidence booster so high
Oh,
that
always,
it could be life changing for them, right? And
always.
the way whether how their performance is at work in their profession, just for their husbands or whichever. I would imagine most of your patients are women, maybe some
Most
men.
95% of women, there's some men that come, but they just say they have gynecomastia, extra breast tissue that we do the operation on them as well. But for the most part, they're women. And yes, they're just so elated and they're so confident and they start doing things that they never thought they could. They wear certain clothing that they never thought they would fit. So those are things that we don't think about as men. Women like to fit in certain clothes. They like to look a certain way. And once that they achieve that, it's just something else. It's like texting and the photos that they send me and how confident they are. Just great. Everybody has their own story and I just love it.
Right, right. And I guess it would be safe to say it's a lot more difficult to be a woman than a man. For us,
It is.
we jump in the shower, we brush our hair, and like we're ready to go. Like,
It's
what's
true.
taking you so long, right?
That's true. No, they just yeah, there's something else. When you transform a woman, it's a beautiful thing.
So can you talk a little bit about the different procedures that you do and what goes on behind them and the preparation and maybe a little bit about the time it takes to recover and the things that they have to do?
Yes. There's some operations that take very short amount of time. Some of the more common operations, such as breast augmentation with implants, can
Hmm.
take about an hour, hour and a half max on an operating room table. They go to sleep under anesthesia. They wake up and it's like a short little nap. They recover within a few days. I
Hmm.
don't let them do any heavy chest activity for about 6 to 8 weeks because I want to make sure the implants stay where they're supposed to be and they get a nice
Hmm.
cleavage as a result. Otherwise, the implant can migrate out, and I don't want to have anything like that.
Hmm.
The more complicated operation would be like a tummy tuck, where we actually have to put sutures inside the abdominal fascia to bring the muscles together to make that laxity much tighter and nicer and flatter abdomen. That will take about 8 weeks of basically restriction from any major heavy lifting, no Pilates, no abdominal exercises for the sutures to maintain and the scar to form and to actually then be able to go back to normal activity. So the restriction of 8 weeks is what the tummy tuck, that's the longest recovery of all the operations that I do.
Is that
Um,
is that what they do, the tummy tuck after they've had babies or done having babies where the muscles have gotten loose?
yes. So people who actually had a lot of weight gain and then they have major weight loss, especially with the GLPs that are out there right now, where people are getting thinner, or pregnancies, multiple pregnancies, where the skin and the muscle and fascia all stretch out. We
Hmm.
tighten the abdomen on the inside and we pull the extra skin on the outside. So it's a two-step process there for a tummy tuck. And you want to maintain those sutures in place. You don't want things to rip and get a bulge or get a recurrence of that laxity. So I have to restrict my patients. And again, I'm very good with my patients. I have my phone number. They have my number. I call them the same night, the next day. They can text me, call me if there's any questions. I'm very hands-on with my patients. And so
Right, right.
I make sure I guide them through the journey, and so they achieve the best beautiful result that they can achieve for their body.
Hmm. And then there's Brazilian butt lift and um
Yeah.
like what's popular now? It's like all
Yeah,
these
that was popular a couple of years ago. Where everybody would come in and get liposuction all around the 360 lipo, which would be abdomen, flanks, waist, back. And then instead of throwing the fat away, we would inject it back into the buttocks. But that was a very dangerous operation in the hands of people who were naive about the operation, people who were actually injecting patients too deep below the muscle where the fat would get into the major vessels and go to the heart and to the lungs. And there were, reports of many deaths actually, like in the Miami area, for example, where people were just not board certified doing this operation. But yeah, there's more safe way of doing it at a surgery center that's certified, doing it by a board certified plastic surgeon who knows the anatomy and knows when to, push and when not to. Yeah, so you can get a Brazilian butt lift with fat transfer to the buttocks. And there's also butt lift for patients who actually have a lot of laxity from weight loss, where you actually have to lift up the buttocks and take out the extra skin or shove it underneath the butt, for example, and give more
Mhm.
fullness underneath. But the skin is loose and the skin has fallen down, so that's a different type of butt lift. But I do all of those actually. But
So
that's more popular because of the GLP-1s, where people are losing more and more weight and have all this extra skin they don't know what to do with. They have arms that are just hanging down here like a bat wings, and we take those
right.
out. We call arm reduction. Breasts fall to the middle of the abdomen. We have to lift those up with the breast lift. And the tummy is loose. We have to tighten that. The back is loose. We have to tighten that and lift up the buttocks. That's all part of the same huge, complicated operation that can last about 8 to 10 hours in a day, basically.
Wow. So once somebody gains a lot of weight, right? I guess you have to gain a lot of weight to have your skin stretch that much,
Yes.
right? If you've gained a little bit of weight, say maybe 10, 20 pounds, and you reduce that, will your skin tighten itself up on its own?
It's yes and no. So the speed of weight loss can affect how the skin forms at the end. So if you lose a lot of weight really quickly, the skin really falls down, and so it's not that great for the skin. Now, if you lose less weight over a longer period of time, your skin will probably be able to bounce back a little bit better. Now, if you have stretch marks from your weight gain, or if it's massive weight gain,
Hmm.
those stretch
Hmm.
marks means that the dermis or the skin has been damaged, and so it doesn't bounce back as well as somebody who doesn't have stretch marks, for example. So there's a lot of different variables that actually lead to the final results. But yeah, if you have less weight to lose and you lose it over a longer period of time, your skin probably bounces back better.
Now, bodybuilders have a tendency of having a lot of stretch marks on their chest, around their arms. Is that because their muscles grew too fast?
Probably, yeah. I mean, I haven't really studied the biology of bodybuilders, but anytime you strengthen things and stretch things fast, yeah, that can give you stretch marks for sure.
Oh, interesting.
Yeah.
Okay. Okay. So if people are going to, I guess the best thing is like don't gain the weight, right? But
Oh,
you
yeah.
already gained it, and then it's like too late. Now you got to deal with the other issues that you had to.
Well, listen, it's better to be healthier, right? Have
Right.
good exercise, good diet habits, and that's probably the
Mhm.
best way to lose weight. So it's always good to lose weight. Now, if it comes with these issues such as extra skin that hangs and it's uncomfortable in clothing, it causes rash, moisture, sweating, and so forth. Yeah, it's
Mhm.
great to do that operation at that point to remove all these extra skin and fat. But yeah, it's always good to be healthy and not overweight for sure.
Right. And then the liposuction is just basically just taking fat out without having to actually go through the work of doing it. Like,
Well, I always tell my patients I don't like to offer liposuction if they just want to do a shortcut and lose some weight, because if you think about it, fat is not that heavy. I will go and liposuction liters out of patients and they don't lose that much weight. They expect to lose 30, 40 pounds. That doesn't happen because weight of the fat is so light that even though you take a whole bunch out, you don't
mhm.
lose too much weight. So for me, it's about patients who actually are really good about their goals, about losing weight, being in good shape prior to having me operate on them, because I'd like to get a good result at the end, just like my patients want to have a great result at the end. So I do want to make sure that they're good candidates and they're going to maintain the form that we
Mhm.
give them with a little bit of liposuction if we have to. And so, yeah, there's some stubborn fat. People go work out, they're, in great shape, and they cannot get rid of certain weight, say certain fat around their waist or their flanks or their, hip area. And so, yeah, those are great candidates for liposuction. But then when we do the mummy makeover, for example, not only are we tightening the abdomen and pulling the extra skin off at the bottom, but we also sometimes go to the sides, waist, and flank. There's a little extra fat sometimes in some patients, and we take that out also. It gives you a nice hourglass as a result. So not only are we bringing the abdomen in together with the muscles being tightened, but also removing some fat from the sides gives you a nice hourglass. So
Right.
yeah, there's some great candidates. Those would be the kind of indications for the liposuction.
So if somebody's going to, let's just say somebody says, okay, I'm going to get in shape, I'm going to do whatever, would it be safe to say that maybe they should talk to you first before they do anything so that you can kind of guide them and, work together as a team, not only maybe exercising or cutting back their diet or whatever they're going to do, but then that way you have a game plan as you get closer to the goals and what you're going to trim or adjust?
Absolutely. I think it's teamwork when it comes to plastic surgery. I think goal orientation is very important. If you have goals to lose a certain amount of weight because you want to have this surgery, then that's always a good reason to actually start going down that line of having good diet and exercise habits. Sometimes people just don't have goals. They don't know what to shoot for, and they don't really take care of themselves as a result. So I think it's good to have that discussion ahead of time and see what's achievable, what's not, and which operation should we do first. Sometimes there's staged operation, liposuction first, and tummy tuck later. Those kind of things we discuss ahead of time. And liposuction. Some people, I have to always mention, people think it's just a little easy operation, little small stab incisions, but really, it does hurt when you do liposuction. So that's another discussion point about making sure that we're all on the same page. So it's not always liposuction. If you can lose weight naturally, you can skip the liposuction potentially and skip that extra pain that is associated with that liposuction.
Or the risk, right? I mean,
Of
I guess
course.
there's always a risk to everything.
Of course, again, in the hands of a board certified plastic surgeon who's done many of these operations, it's a very low risk. But yeah, I've heard a lot of stories about patients who had major injuries where the cannula went below the abdominal wall and went into the abdomen itself, causing injuries, internal injuries. Patients have died because they've been, basically botched by non-certified plastic surgeons, or even in some
Right.
cases, they may not be paying attention. They have some assistant doing it. And so, yeah, you got to be very careful about who you go to.
Right. So that's a like that sounds like because you've brought it up more than once is if anybody who wants to have anything done, any procedure should check to see that the surgeons are board certified, making sure
In that specialty. It's not just board certified. There's some surgeons who are, let's just say, OB-GYN, and they're board certified OB-GYN doctors, but then they go and do some sort of fellowship
oh,
or
okay.
weekend course, and then they call themselves a board certified cosmetic doctor or surgeon, they call themselves. So you
Yeah.
got to be very careful. They have to have done training, in my opinion, in plastic and reconstructive surgery, where you
Mhm.
actually spend years understanding the anatomy and the operation and fundamentals, and then do extra training in the specialty in plastic
Mhm.
surgery, which is again 2 to 3 years, depending upon where you go to school in this country.
Wow. No,
Yeah,
that makes a difference.
yes.
Now, how difficult is it to make those incisions like I don't want to say scarless, but so that you can't see the scars because that's important too, right? It's like you get this work done and then you see a bunch of scars. That doesn't look good.
That's right. So, as I mentioned, as you mentioned, actually, that one thing about my scars are for tummy tuck, for example. We use that as an example here. We, I like to set it very, very low, where it actually gets covered by the underwear or bikini. There are a
Hmm.
lot of before and after photos where people look on the internet, and I always warn my patients when they come for consultation, be careful what you look for, because they'll see something, they get freaked out and say, "Oh, I don't want to have this surgery because I'm going to get a scar way up here." But some people put their scars like within a couple of centimeters or maybe a couple of inches away from the belly button, and that's very visible, right? It's a big
Hmm.
scar that goes across the abdomen and towards the hips. Now, if you put that much lower, right in the pubic area, and your underwear covers it, and there's a good distance from your belly button down to the scar, nobody notices it because it's concealed nicely in your clothing. So
Right.
what we do is not scarless. What we do is we kind of like to put it in areas that are inconspicuous where people cannot
Hmm.
see.
Right.
So that's where the art comes in. Where can you hide, some of these incisions? For example, this guy who does a lot of breast operation in Beverly Hills was putting on his social media the other day, and my staff kind of noticed it. Just talking about how he avoided having any scar, the horizontal part of the breast, the anchor
Right.
scar, and was showing the breast, which had like almost no shape. It was like a boxy looking breast. I'm like, okay, so there's all this extra tissue in the armpit that needs to be brought in, and you need to do that by putting incision in the crease of the breast, which is hidden nicely eventually. So
Mm-hmm.
don't be afraid of putting scar in the crease of the breast and get the shape much better, as opposed to
Right.
say, oh, I just did a lollipop incision on a lift, and now I
Yeah.
got a boxy looking breast, but it's telling everybody, oh, this looks beautiful. I'm like, that does not look beautiful. So
Okay. That's true. You make a point, right? At the end of the day, it's the shape and how it
yeah,
all ends up, the finished
that's
product
that's right.
that drives it home or not.
But that's the thing. Our job is to make sure we hide those scars, but do the right operation to get the best shape, best
Mm-hmm.
look, most natural look at the end.
Right, right. Yeah, I mean, if you're going to go through the pain and you're a woman, you want to look better.
Of course.
You want the best product for yourself so that you shine the brightest, I
That's
guess.
right. You're
Right?
investing in yourself, right? That's the best
Yeah,
investment you can do. And you're spending a lot of money, might as well have the best results.
right. No, no, 100% agree.
Yeah.
So as we get ready to wrap up the interview, do you have anything exciting coming up in the next 6 to 12 months?
I'm kind of looking into this whole industry, the peptide industry. I'm sure you've heard a lot about it, not just the GLPs, but actually there's a lot of, I have some patients who actually are very knowledgeable about the peptides that people have been using, injecting to get a more rapid recovery.
Hmm.
And so I'm trying to understand the science, and there's a lot of information out there, a lot of anecdotal evidence, and I
Hmm.
haven't seen like evidence like in a scientific articles. I'm very evidence based. I need to see if they
Right.
compare one versus another, group that doesn't get the treatment. How does that, change the results at the end? But everybody swears by it, so I'm looking to bring that into my practice. But I do want to make sure it's safe products to bring in. There's really no major FDA oversight right now on those medications, the peptides, but there's a lot of patients, a lot of my colleagues, a lot of people I see when I take my kids to football practice and so forth. They swear by it. They took this BPC 157, whatever, injection, and they heal so much faster. So I'm trying to bring that eventually into my practice for my patients to make sure that they can recover faster. But I got to make sure that actually they're safe to use and, use a reputable sources to bring that medication, because there's a lot of reagents coming from China, for example, and there's like no
Right.
oversight. So what are we injecting the patients? So we got to make
Right.
sure we have one oversight. And the other one is the Elixir MD, which I've been using. Is light therapy, LED light therapy, that actually decreases the recovery for the patients by about 50%. I like to use that before the operation to minimize the bacteria on the skin. I like to use it right after the operation, which is yellow light, to minimize swelling and bruising, and then red light to help with the collagen formation. So this combination of these things, the LED light, the peptides, and good skills will give great results and faster recovery for the patient. So that's what's coming up next.
No, that's amazing. That's amazing. Well, Dr. Paydar, thank you so much for sharing what you do. Super interesting in that. I know many women would like to maybe consult with you or talk to you about it. How could somebody get a hold of you who might be listening?
Um, so Paydar Plastic Surgery and Dermatology, we have a website, www.paydarplasticsurgery.com. That's PAYDARPLASTICSURGEY.com. On Instagram, Dr. Keyian Paydar, KEYIAN That's one way on Instagram. Our phone number, probably the easiest, is area code 949-755-0575. We have Haley who can pick up the phone, and Chrissy, our coordinator, who can reach out to you, and they're fantastic. And it's a concierge type of service here.
Very good. Well, thanks so much for coming on.
Thank you for
And
having me.
yeah, absolutely. And to our audience, please go to ocpowerplayers.com and follow us on your favorite channel. Thanks so much, Dr.
Thank you.
Paydar.
Bye bye.
Thanks for listening to Orange County Power Players. Want to share your success story? Apply to be a guest at ocpowerplayers.com/guest.